Good morning, everyone. I am not John McIntyre, and I do not have his finesse. However, he is not able to be with us today, and so he's asked me to convene this group of the Behavioral Health Coordinating Council on this June 17th, Friday. Welcome, everyone. I'm glad to see everyone. We do have a very robust agenda with some extra items that we typically don't have included in our agenda, and so I would like to be cognizant of all of your time and keep this moving right along. So with that, I am going to call the meeting to order and ask Mandy to take roll. Wherever Mandy went. Oh, there she is.
Kristen Adams, Stephanie Barish, Donna Bolin, Rebecca Foley, Lynn Fulton, Joan Hartman, Jeremy Hayes, Tricia Malott is here for Mark Jontry, Teresa Prosser is here for Colleen Canaday, Pam Reese is here for Kevin McCarthy, John McIntyre, Colleen O'Connor, Sonia Reese, Elizabeth Robb, Susan Schaefer, Diane Schultz, Matt Mollenhauer is in for Dave Sherrar, David Taylor, Eric Tomey, Lisa Thompson, and Brian Whipperman.
Thank you, Mandy. Next on our agenda is the approval of minutes from March 11th, the regular meeting, and the April 8th special meeting.
Second.
Sonia moved, and it was second by David Taylor. Discussion? All those in favor? Aye. Opposed? All right, moving on to the next item. We have appearances by members of the public, and we do have Kathleen Hayes with us today. If Kathleen could step up. If you could come over here to the podium. Similar to last night, the mic should work this time, Kathleen, so if you want to push the little button on the side. And you have 5 minutes. On the side there. There you go. Whenever you're ready.
Hi, my name is Kathleen Hayes. I am a project coordinator with Illinois Recovery Corps. For my year of service serving McLean County and Bloomington Normal, I have been working with the McLean County ROSC on research into different peer recovery support service programs. For what they were wanting to look at doing, they want to implement possibly a recovery community center for the substance use and mental health recovery communities for Bloomington Normal and McLean County. To finish out my year of service, I am conducting a community-wide survey on community interest and readiness to implement such a program / organization. I have with me today, what I'll pass out afterwards, I have a handout that has a QR code for going to the survey. You can just scan it with your phone. There's also a link for it. The more responses we can get, the better. That way it's to better inform the community and the McLean County ROSC on decision-making going forward. So thank you.
Kathleen, if you'd like to leave them on the table back there, some other materials are back there to pass out. So, all right, moving on. We are to item 4, items to be presented for information, and the first one we have is the NACO recognition of our member Susan Schaefer. So many of you will remember that several years ago the county became involved with a national campaign for data-driven justice. We had several that went out to Washington, D.C. to be part of a collaborative. We were chosen for our efforts here in McLean County. And so the National DDJ Initiative through NACO is now completing a rebranding. They're in an effort to rebrand. And part of that is to highlight, they're doing a what they're calling a community portrait series. And in that efforts, they are highlighting individuals who have championed cross-systems collaboration and data sharing within our jurisdictions to respond to the needs of frequent utilizers of justice, health, and human services systems. And Susan Schaefer, on behalf of McLean County, was approached to complete one of these community portraits, and I think it's a great testament to the work that she has done on behalf of all of the boards that she serves on and advisory groups that she's been a part of, but it also lends national recognition to McLean County. And so there is a handout that we have to share more about that. But Susan, would you like to speak on that at all? And those interviews?
Thanks. Yeah, it was kind of totally unexpected because of some of the individuals that they've chosen in the past. And I'm, pretty honored but humbled by that. But it's a testament not just to me, but it is a testament to the individuals around this table too, because we have done a lot moving forward and improving things in McLean County that it's national recognition, not just for me, but for the county. And so I appreciate every one of you that has helped me along the way to become that champion for the county. And so I hope to continue the work with DDJ, and that's one of the items in our action plan to continue with that, and I will be continuing with that with all of your support. So thank you very much. I appreciate it.
Thank you, Susan. Next up on our agenda, we're going to keep moving right along, guys. So next up is our update from Judge Rebecca Foley.
Good morning, thank you. My report is just a two-part report. One is just a quick update on the interaction with the BHCC and the CJCC, the Criminal Justice Coordinating Council. I have confirmed that the seat that was reserved for Ms. Malat when she was in Vanessa's role remains open for Vanessa or her designee to attend the quarterly CJCC meetings. And that next meeting is July 21 at noon. They meet here in this room, Vanessa. I'm sure you're aware of that. And then I also want to, with Vanessa's approval, look into the potential for the BHCC's coordination with the JJC, Juvenile Justice Council. There's a lot of overlap, obviously, with youth in what we do and what they do. I think Ron Lewis is the new chair or coordinator of that council, and so he's very aware of the overlap. I'll work with him to try to get that accomplished as well. Just what you want, more meetings, right? The other part of my report is an update on what the Illinois Supreme Court has been doing relative to mental health efforts. In late 2019 and early 2020, the Illinois Supreme Court, through the Administrative Office of Illinois Courts and with technical assistance from the National Center for State Courts, formed an interdisciplinary, multi-branch group of leaders known as the Illinois Mental Health Task Force. In the last quarter of 2020, the task force sponsored what they wanted to be a live event, but had to be a virtual event. But it was a 6-session series titled Improving the Court and Community Response to Persons with Mental Illness and Co-occurring Disorders Through Compassion and Hope. That series identified 9 challenge areas, and those were access to care, awareness and education, continuum of care, criminalization of mental illness, crisis response, early intervention, social determinants, funding, and a need to revise the Illinois Mental Health Code. In 2021, the AOIC hired Scott Block as Illinois' first statewide behavioral health administrator. He is tasked with facilitating the task force response to 5 goals, which are: build a community-by-community approach supported by statewide leadership from all 3 branches of government, conduct a statewide mapping or needs assessment to identify what is working and what gaps exist, assist in creating a vision for Illinois' mental health continuum of care, develop and implement a statewide strategic plan, and assure accountability through transparency and accessible reports on task force activities. So the task force has developed these 5 multidisciplinary regional mapping committees. They are in line with the DHS regional boundaries. And so over the past several months, those regional mapping sessions were held. Some of us were part of those virtual series. And they used the SIM, or the Sequential Intercept Mapping Framework, and discussed each region's resources and gaps, as well as what must be accomplished to improve the court and community responses. According to the website, the task force timeline indicates they will complete the mapping report sometime in the month of June, so I'm hopeful that we will expect that soon. The only other thing I wanted to report is when I was on their website, and I have received communication, there is an open application for funding. It's a 1-year pilot project that seeks to improve outcomes for justice-involved individuals by embedding what's called a court liaison. Are you familiar with this, Cassie?
Yes, as is Judge Fellheimer and Will Scanlon, and I believe we are going to be applying for that.
Okay. For those of you who aren't familiar, it would be a grant that would embed a court liaison to assist in cross-system navigation. So that's on the website. Applications are due the 15th of July. So very good. Any questions?
Thank you, Judge Foley. For those of you who aren't as familiar with the criminal justice system, Ron Lewis is our public defender, and he will be leading our juvenile justice council. As Judge Foley was going through the description of those efforts, some of those topics might seem very familiar. McLean County was noted in many of those task force work groups as being a leader and kind of being ahead of the curve. And so, again, it's kind of a feel-good moment for us, because as they are developing things for the state, Scott Block, who is exceptional in his role, has noted that a lot of the things that McLean County is doing are things that he is championing for the rest of the state. And so we will look to that group, to the national, I think it's called Coalition Accords, but also the state efforts to develop those partnerships between the justice system and behavioral health to help guide what we do in the future as far as our mental health action plan and the metrics that we'll be collecting for those efforts. So, thank you. Next up, C, we have our update on the baby fold from Diane, and I think she gave everyone a handout.
Well, there are handouts on the table if you didn't grab one. And I'm not going to go totally through the handout, but just wanted to take the opportunity to say the baby fold's 120 years old this year, providing services in McLean County. So that's a real milestone. On the front page, you'll see the array of services that the baby fold provides. Historically, we've altered and revamped those services to try to meet unmet community needs. People keep telling us, oh, we didn't know the baby fold did that. And it's probably because we try to be flexible and look at unmet needs in the community. There are some key services that I do want to talk about and to maybe illustrate funding challenges that can occur, and as we continue to map out our system of care for mental health and particularly prevention services in our county. Our community schools program, there's information and outcome information on the additional pages in that handout. That's where we have an embedded social worker at Fairview Elementary and Cedar Ridge within the Unit 5 school district. And that really is a wonderful example of prevention work where we're trying to provide individualized mental health and physical supports to families that are in need. And those needs are impacting that student's ability to come to school well regulated emotionally, as well as being able to benefit from academic instruction. And so we are trying to pick up the achievement gaps that these high-need kids may have and do that in collaboration with public school staff that are in that building. Another program that is newer and people may not be aware of, Caregiver Connections, is a program where the Baby Fold is actually providing consultation services through a trauma-informed lens to daycare providers to assist those staff to be able to work more effectively with kids that are in daycare. And this is both in daycare centers as well as individual licensed daycare homes. To just help them with kids that may have higher needs than they might typically see across the general population related to their emotional and behavioral stability. We operate those consultation services in Sangamon County, McLean County, and Champaign County. So we have 2 full-time staff that serve the McLean County area. The last program I wanted to touch on is Healthy Start. And partly because I think it's another example of how collaboration in the community benefited McLean County. That program was created about 27 years ago with various stakeholders, not just the Baby Fold. United Way was one of those partners to bring this abuse and neglect prevention program to the county. But like any prevention programs, whether it's community schools, whether it's Healthy Start, I'm kind of looking at Lisa, they do a lot of prevention work. Anyone can tell you, prevention funding is very unpredictable and unstable. And but Healthy Start, the good news is we've been doing this program for 27 years. 60% of the families in Healthy Start, those young parents who are now pregnant, and we start working prenatally with them, 60% of those expectant families grew up as children in homes where they had contact and connection with DCFS. So that's kind of the population that we're working with. 95% of those families, 3 years after we've stopped that service, are still abuse and neglect free in that family. That is a phenomenal statistic when you think about 60% of those families as a child grew up in a home that needed some DCFS support or intervention. So to illustrate the unpredictability of funding and the last concluding comment I want to make, the Baby Fold in a 5-year time span looking at 2017 to 2021 provided about $800,000 of charitable giving to operate these programs. Now, the Baby Fold views that as part of our mission, fundraising and being able to provide services that could not otherwise exist in McLean County. That's part of our organization's mission. So we don't typically look for a pat on the back about that, but what I really want this group to recognize is that's not unique to the Baby Fold. Every nonprofit in this community is looking at charitable donations and other means of funding to keep our existing services in place. And when you look at community schools and Healthy Start and the return on investment in prevention work, to me that was $800,000 well spent over that 5-year time period. But as we continue to look at our system of care, whether it's the county resources for prevention work, whether it's something that comes through the system of care grant that has been applied for, we've got to make sure we're continuing to invest in prevention. So That's my spiel. Thanks for listening.
Thank you, Diane, and very timely. Through collaboration with the county and several child-serving agencies here at the table, in April 18th of 2022, sorry, the date came so quickly for all of us that worked on this grant. We submitted a Systems of Care grant and are hopeful to be rewarded that grant. We will know if we receive that reward in August. So August 1st, 2022 is the reward date, with services expected to start in September. And so what I would encourage is that our next BHCC meeting is focused on child-serving agencies in our community, mental health concerns focused on youth. Because here's the thing, is if we don't get the grant, that doesn't mean we're not going to go for it again. What all of you came together and did in a very short time, and 2 weeks is the amount of time that these agencies came together and put together a really competitive grant. We're going to build upon that. And as Tri-West informed us, these grants are offered pretty much on a yearly basis. And so I want everyone here at the table to know that should we not receive that award, although I'm slightly confident that we are, if we do not, that will not be the end of it. And so September, I would really encourage that we all think about our special topic being youth and child serving systems in McLean County and how we might begin to move forward, not only the initiatives that we have outlined in the Mental Health Action Plan, but what else is out there to fill those gaps.
Any other questions or discussions for Diane or the topic of youth now that we're on it? Okay, then next up we have our update from MCCHS from Joan Hartman.
Thank you for the opportunity to speak this morning. I don't have beautiful things like Diane has to pass out, but I did want to talk about one program that is new for us. We are in partnership with Heartland Community College around the Recovery Support Training Program. MCCHS will be the learning lab for that program, which means that we'll have a program manager who will kind of guide all of the students through their internships, no matter where their internships are. And so the role of that individual is to help them create their care plans and self-care plans, and to be able to process through things that come up that might be difficult to deal with as new people in the field, especially people with lived experience. Sometimes the things that we all know that in behavioral health we experience vicarious trauma in the services that we provide to individuals. And so this program will help individuals with lived experience to be able to process through that vicarious trauma and to be able to be successful in their new careers. And so the other piece that they'll be working on is working with sites, other agencies, to provide locations for these students to go to. It's my understanding, I'm an instructor in that program also, which I love doing that as a side job. But it's my understanding we have a full cohort of students this fall, which is 20 students, which is going to be a huge difference for me. I'm used to 6. So we'll be calling on other organizations to host interns, and then we'll provide support for those interns and the supervisors who supervise the interns, because it's a little bit different type of supervision than what you're used to with like an MSW student. And so we want to make sure that the supervisor and the student are both successful. So we'll be coming around talking with you guys about the program and about taking students and things. We're very excited about it. We really feel like our clients that we serve, or our guests that we have at the center, are going to, that's one thing that we're missing is that recovery support given by a person with lived experience, and what a better way to get that off and running than to partner with Heartland. So any questions, let me know. Very excited about the program. And we're going to make sure that you guys are equally excited about it by the time we're done meeting with you.
So individuals who are interested in hosting one of
Just
your
let me
students,
know.
just contact you directly?
Yes, and if you don't contact us, we'll contact you. So just be prepared.
Thank you, Joan. All right, so next up, we have E, our mental health action plan comments and discussions. We have, at the end of the table, we have several guests with us today, and we will introduce those individually. They are here at the behest of our County Board Chairman, John McIntyre. Individuals came to the county board meeting to express their interest and comments on our mental health action plan. And Chairman McIntyre felt that it would also be beneficial for a discussion with this group in regards to those comments. And so that is why they are listed here under our items for information, so that we can have a back and forth discussion if need be, if anyone would like to ask questions or answer questions of the group that has come today. And so we thank you for getting up early. I know a 7:30 meeting on a Friday is not the favorite on the calendar usually, but I do appreciate all of you coming today. And so with that, we will go down the list in order of response. And Chairman has indicated that you each have 10 minutes to speak for your time frame with the group. I'll also let you know, though, that several of these individuals usually have other meetings immediately following this meeting, and we have received all of your written comments, and I believe many have read. I see nodding heads that people have acknowledged that, and so I ask that if you have new information to present or have excerpts that you'd like to highlight out of your written materials, um, just to acknowledge that we're on a kind of a time crunch, but also want to honor the 10 minutes that Chairman has offered to each of you. So with that, we have first up is Zach Gitrich.
Hello, thank you so much for your time. My name is Zach Gitrich. I am a member of the Central Illinois Research Collective, and I am also a member of the statewide CESA Coalition. And today I'm going to be talking about very specific parts of the Mental Health Action Plan and relying on data as I inform you more about a new law called CESA. That stands for the Community Emergency Services in Support Act, also known as the Stefan Watts Act. It was passed by both houses of the Illinois legislature unanimously, signed into law by Governor Pritzker in August 2021, and it goes into effect January 1st, 2023. The push to get CESA implemented was led by Access Living and Advance Your Leadership Power, a group of disabled activists that use their own lived experience to advocate on behalf of disabled people. The impetus for CESA started back in 2012 when a 15-year-old black autistic child named Stefan Watts was killed by police when he was having a mental health crisis. So basically, what is the problem? And a lot of you will already know this. In Illinois, 10% of 911 calls are for mental behavior developmental crisis. Typically, 911 can only dispatch police officers. Law enforcement practices focus on command and control of a location, which oftentimes makes many of these emergencies worse. Law enforcement skills are rarely needed, as people with mental illness are less likely to be violent than people without such a diagnosis. And law enforcement is generally compelled to hospitalize or jail people needing this service. In McLean County, from 2018 to August of 2021, 10,733 emergency calls for service were made for mental health emergencies, and that's from the report. It is estimated currently at the McLean County Jail that 30 to 35% of the incarcerated people have some form of mental behavior or developmental disability, and based on the average population, that's between 65 to 80 at any one time. So what does CESA do? CESA creates alternative responders for nonviolent, non-criminal mental behavior and developmental crises. CESA is based on the CAHOOTS model that operates in Eugene, Oregon, and dispatches teams of medics and crisis workers. These mobile crisis teams respond without police. They attempt to resolve the crisis and or transport a person to appropriate medical provider. This will save states and local dollars by supporting people in the community rather than emergency rooms and jails. To give a number with the CAHOOTS, in 2019, they responded to 24,000 calls. The CAHOOTS team resolved almost 20% of all calls that came through the city's public safety communication centers, and they are only 2% of their police budget. So what are these alt responders' responsibilities going to be? Well, it's going to be to divert from hospitalization and incarceration, provide on-site care as appropriate, recommend appropriate referrals for additional support, and provide transportation to appropriate care settings as directed by the individual receiving care. So it's really important that this law is seeking to empower the person that's having a crisis so that they feel that they are in control. Now, I do want to talk about the difference between a co versus alt responders because there's a lot of these different models. Co-responder is a crisis team responds with police, and an alt responder model is crisis teams respond without police. The philosophy of why CESA supports alt responders is that mental behavior developmental crises are still stigmatized and criminalized. These crises require a public health response, not a police response. So alt responders remove the police apparatus from these crises and enters the healthcare apparatus. These is a first responder bill, so who's the first person on the scene? A healthcare professional. Who's the person with authority over the scene? A healthcare professional. And the law explicitly states that just because someone is in crisis or suicidal, they are not a risk to public safety. So it's up to the healthcare professional on the scene to decide, can I handle, is this a healthcare situation or do I need to bring someone else in? Now, with that being said, what type of police involvement is allowed under CESA? Alt responders can still communicate with police and the entire emergency network. CESA allows police to be present in the area out of sight in case their assistance is requested. I will point out in 2019, of the 24,000 calls that CAHOOTS responded to, only 311 required police support. That's 1.3%. As I said before, just because someone has a diagnosis of mental behavioral health doesn't mean they are a threat to public safety. That's in the law. The only time that police are allowed to respond to these non-violent, non-criminal calls are for suicides, which we would actually still want majority to be alt responders, except in situations where like they have a firearm or they're actively trying to harm someone else. We would still rather that be an alt response system. Because again, people who are suicidal are typically no danger to anyone else but themselves, and that's why we're trying to switch that from public safety, public health. The other situations is if no alt responders are available, then police can respond. And police can also contact the alt responders for assistance. I did want to mention crisis intervention training. Obviously, all the officers in McLean County receive crisis intervention training. In Illinois, officers who volunteer for this specialized 1-week, 40-hour program receive intensive training. However, CESA does not distinguish between CIT-trained officers and non-CIT trained officers. And the reason is because the difference is negligible. And let me explain what I mean by that. An officer goes through, right now, about 14 weeks of training at the academy. On top of that, thousands of hours of continuing education on a wide variety of subjects. So the difference between a CIT-trained officer and a non-CIT-trained officer is 1 week. Now compare that to the alt responder, who is a crisis worker, a medic, social worker, who has years and years of experience, probably degrees and certifications in this one specific area. So that's why CESA does not distinguish between the CIT-trained officers and the non-CIT-trained officers. So quantitatively, we would say that that addition is negligible. This CESA is going to be run by emergency response equity committees. Each EMS region is going to get its own equity committee. They're going to provide the guidance to prioritize calls for assistance and setting the standards for appropriate response times, set appropriate training requirements and staffing minimums, as well as how long the alt responders have to respond. If they can't make it within that time period, then you can send the police. And specify regional best practices. So that's a good thing. It's not just going to be Chicago heavy. Each region is going to kind of be able to control itself. And McLean County is already really well set up because we do have a mobile response team. So again, McLean County is way ahead of a lot of other things. When it comes to the continuum of care, the only question that we as CESA have is it CESA compliant? Is it available 24 hours? Is it a non-police response? And does it respond to a wide variety of mental behavior developmental crisis, not just suicide calls? If those three things are met, then it's CESA compliant. Obviously, CESA and 988 are being rolled out together. I'm not going to go too much into 988 because I'm sure a lot of you are familiar with it. But the other thing I wanted to go over was CESA and the Deflection Act, which is technically a separate law. The Deflection Act is the Community Law Enforcement Partnership for Deflection and Substance Use Disorder Treatment Act. The Safety Act updated it. It allows for collaborative deflection programs for substance use treatments and other services as an alternative to traditional criminal justice involvement. CESA pertains explicitly to non-criminal emergencies in which law enforcement involvement is prohibited. The Deflection Act explicitly pertains to law enforcement involvement in criminal situations. So if it is a violent situation, a violent to public safety, or if there is some type of crime being committed, then you can send the co-responder and it's under the Deflection Act. If it doesn't meet that criteria, if it's non-violent, if it's non-criminal, then it's what we would consider a CESA call. And so the Deflection Act and CESA do not conflict, but they complement each other. And what will likely happen is that the mobile crisis teams that we have will respond to both. They'll co-respond for the Deflection Act, but they'll alt respond for the CESA-related calls. And I got through everything. I hope I got through everything in enough time. I rushed through it. So if anybody has any questions, feel free to ask me. Like I said, I am part of the statewide coalition, and we did work to get this bill passed, and now we're working to get it implemented. And I think McLean County is going to be a leader in this.
Any questions for Zach?
I have a lot, but I don't want to take up time today. So do you have a contact information? Was that provided in the packet? I didn't print the packet off, or can you provide contact
Yes.
information? Thank you.
And I'll send, this is a slide. I can also send
Okay,
this to
Great,
everybody.
thank you.
I think Zach includes his contact info at the end of his emails as well with the organizations that you've created.
Yes, so I'll send it specifically for the Central Illinois Research Collective.
I have a question. Could you please tell me who is in this research collaborative, how it came about, and what expertise do those individuals have? Thank you.
Oh, the Central Illinois Research Collective. It's a group of people within Central Illinois. We got started in August, but we mainly focus on transparency and accountability, helping people fill out FOIAs, helping people with get police records, file police complaints. But then we also work on lobbying for bills for legislation that we think is in the interest of the working people. And so CESA was one of the things that we directly lobbied on, and we're part of the statewide CESA coalition. So our experience is based on our relationship with the statewide coalition.
And the statewide coalition is led by whom?
Access Living, which is a disability rights organization, and Advance Your Leadership Power, AYLP, which, as I mentioned before, was it's a group of disabled activists that have been advocating for themselves, advocating for policies that benefit them for many, many years now, and getting CESA passed was a huge achievement for them.
Anything else for Zach? Vanessa's helping me keep us on time, so. Thank you, Zach.
Can I ask just one question?
Sure.
So the current mobile crisis teams that we have now, how do they respond now? Is it an alt responder, is it a co-responder model? I don't know if, I figured it was you.
Thank you for asking. We do both.
Okay.
So we respond both. Most of our responses actually are in the emergency room. One of the things that we're excited about with this project is the fact that we're hopeful that we can deflect and see those individuals out in the community more often. But we do respond out in the community, and we respond to hospital-based programs. We respond with the first responders, whoever response, whether it's ambulance or police, when we're contacted by them to do so. A lot of times we don't get there in time to provide the crisis service because it's already decided by the time we're able to respond. So,
Okay, so normally it's not somebody calling 911 and specifically asking for you, it's some other agency calling you in?
right, there's two, the system that we're working on, and we're aware that thank you for saying that we're ahead of, because we found that too. We've been actually surprised at how far along we are compared to the rest of the state. So we're very proud of that, but we also know that there's a lot that we can do that we could do better. And so I think with the 988 coming into play, people will be calling 988 rather than 911 is our goal. And then we can respond rather than having the police go out and then us wait, or them then contacting us and us being secondary will be the first. And so in this community, they can also call PATH. They can call us directly, and then they can also call PATH. And PATH usually dispatches us without a police response first.
Thank you so much. That
You're
really
welcome.
clarified things for me.
Anyone else? Thank you again. Next up, we have Elizabeth Johnston. Thank you, Lizzie.
Thank you. I apologize, I did not send out my written comments ahead of time, but I can send them out after the fact. I am Elizabeth. I am on the McLean County Board. I'm also a clinical social worker here in the community with OSF, and I teach a class at ISU, an advanced practice class, discussing integrated behavioral health and the benefits of that program. I've spent a good bit of time kind of reading through the mental health action plan with the updates, the BHC updates that you guys do here, the ones that Vanessa provides to the board. Last night I was reading through the minutes from the March and April meeting, and going through it really does, when you do such a deep dive, you really understand the enormity of what we are trying to accomplish here. At the end of the day, as a counselor, I do understand that, sometimes progress is incremental, and sometimes it's got a high magnitude. And so what I see with the mental health action plan is that I don't feel like it's adequately describing what we actually accomplish here, or what you guys are accomplishing here. As an elected official, I see my role in the action plan is making sure that we are accountable to the taxpayers. This action plan is what a taxpayer would find to try to read and see what we're doing. And so in the same way that everybody here is accountable to their own stakeholders, to their own board of directors, I want this mental health action plan to be accountable to the taxpayers. When you create your plans for your community, for your organizations, you create your own metrics, outcome expectations, and plans for how to achieve that. And so that's what I'm looking for to see as we kind of move forward, as we look for further updates. This is a living document, and I want to make sure that we're kind of pushing for that. Looking at the mission statement itself, this group was created to improve the behavioral health of McLean County residents and create systemic change through innovative program and strategy, which is a very lofty and admirable goal. I am one who really pushes for openness, accountability, transparency. We've talked about that a lot here today. Those are hallmarks for doing programs like this. And so, even in the plan, it reflects the fact on page 85 that when implemented in real time, which is what we're doing, public transparency does provide an extra layer of urgency and accountability. So these are the things that I'm going to continue to be pushing for. I do believe that it provides good governance and establishes good faith with the public to have it accessible. So looking at kind of most salient points of what I see when I read the plan, trying to read it as a lay person, is that, and having conversations with people in the community over the last 2 to 3 months, some of the biggest concerns that they have is that we don't have what looks like SMART goals in the plan. And it doesn't mean they don't exist, they're just not documented. And that's a big concern for me. We want to be able to show the community, that we understand the shortfalls and that we are creating a plan for how to address it. So looking at these, when I read through on each of those categories, we've got an action, and then who's in charge, and then what are the metrics for showing gains, for showing improvement. And when I look at it, the majority of it has to do with gathering data, analyzing data, and having meetings. And as a provider, those kind of generic terms is not something that I would want to see. Like, it's not what I would give to a patient to say, okay, well, let's go get some better sleep. We actually want to create a plan for how do we get better sleep? What are your steps that you're following? How will we know that we have achieved better sleep? And that's what I'm looking for. That's what I'm encouraging as we look to the next update, because as soon as we get one update, we start working on the next one. So as we're doing that, that's what I want to be looking at. When we think about what we see in there that is tangible, most of the community members are not going to be able to connect with some of the biggest ones, because those are the ones, as far as monetarily speaking, have gone to the jail debt service, and what we've got large chunks slated for the Aegis system for the communication. Those are part of the original agreement. They are valuable, but as far as residents, what they're looking for are these more deliverables, right? They want to see health initiative services programming. And in that case, the triage and the Fuse Center are the ones that are the most demonstrable products, but they're really limited in their scope of delivery as far as like the number of citizens in McLean County that they actually touch. And given the state of our mental health crisis in the last 2 years, I still feel, and I know that Ms. Granger-Belcher has stated this clearly, like the triage center is one of the most underutilized services in McLean County. It has so much potential. I'd really like to see us be able to expand that, and I look forward to hearing some of the ideas on what we can do with that. And this is where, in some of the updates that I've seen, is that we have programming coming out. So somewhere these metrics are outlined, somewhere somebody is working on them. I would just like to see them kind of incorporated and documented so that the public can be aware of it too, so the public can be as proud of what you're doing as you guys know what you're doing. What I will say is that in the meantime, as we're kind of waiting for a lot of these plans to take fruition, kind of the boots on the grounds providers, they are struggling. Caseloads are full. Organizations cannot find providers to offer relief. People are struggling because they can't find services. Whether they have insurance or not, they cannot find services. On my busiest days, I will see 15 or more patients a day. I see 50 to 60 patients a week. That is 650 to 700 individual lives that I touch every year as a provider. So there is a huge need, and I want to see how we can kind of start to expand those services. I am really meant to have same-day, next-day services be in my role as an embedded behavioral health provider, and I am looking at 3 weeks right now. People cannot get in to see me for 3 weeks, and if I need to make a referral to long-term, September, October, if they're lucky. Psychiatry, 6 to 9 months, right? These are some of the things that people are really hurting on that, and they're touched on in here, but I'd really like to see very specific so that we can show the public, like, here's our timeline. Here's some concrete steps that we're taking to start achieving these goals and start to give people access, right? And so, and as much as admirable as these kind of goals and action items are, that's where I want to be seeing us move into that kind of service development. How do we expand those services? Kind of the second main area of concern, kind of reading through this, is the disjointed oversight of services. Even in the outlined structural organization, there's a persistent, institutionalized, and siloed approach between the BHCC, the Mental Health Action Board, 377, CHIP, Jail Mental Health, even as this group is really designed to eliminate some of those silos. And so I will ask that we kind of consider, is there a way to reimagine this so that we can get them more in collaboration, more into working together? Not that you guys don't work together, but to actually have a communication plan kind of outlined. Because they do look, in the organization plan, they look very disjointed. Speaking to the jail mental health, the intercept model that is structured in there, as Judge Foley spoke of, it's outlined in a way with expectations that could very easily be converted into these kind of metrics, these SMART goals. There's a lot of details there. And so things like transitioning that into our action planning is to say, these are the things that we're trying to accomplish, and this is how we know we'll meet them, right? So that's one area that could very easily be transitioned into that. We do cite the challenge in there about criminalizing mental illness, and that we have that potential to bring systemic change to behavioral health in our community and in the jail population. And part of that is going to be working with mental health in the jail. And right now, as far as I can tell, the accountability, the oversight for jail mental health really kind of stops at the walls there, the doors. And so I would love to see if there's a way for BHCC to start collaborating with mental health services in the jail and making sure that they are, that the inmates are getting what they need to be successful when they get out. Okay. I know that as a county, we are experienced grant writers. As Ms. Granger-Belcher spoke earlier, we put together a very powerful one. When we write grants, we know that we must be able to incorporate these kind of goals, metrics, and service delivery outcomes in order to be awarded the money. And I feel like we should not expect any less for the residents of McLean County, the ones who are paying the sales tax, who are funding this program. When we look at the action plan, we want to make it a success, and they're the ones that are funding this. Earlier this year, Mr. McCarthy requested a budget outline that he could take back to our funding partners to demonstrate some financial accountability. And so when we talk about rewriting it, I'd love to see us be able to incorporate not just the financial pieces, but the actual action steps that we're taking towards that goal, and understand how we know we will have achieved it. So specifically, I want to make sure that we are incorporating, and not that you're not going to, I think you're going to for sure, is incorporating the information from the Tri-West survey as we start building out. I'm hoping from reading the conversation that happened last time, I am so close, that as we were reading reading the minutes from last session, is that he is planning to give us very specific plans. And I'm hoping that will include action steps that we can include for things like attracting and retaining psychiatric services, having and building out or bringing in somebody who can run an adolescent inpatient facility, and then better utilization of the triage center. So I am very proud of what McLean County and this committee has done, taking powerful steps to initiate this response for a growing need. And so we have so many of the pieces that are in place. We are so close to being able to achieve a very, just a massive goal, and really a star across the United States for what we do. And so I will see my time. Thank you very much. And I can send the comments out later if you'd like.
Does anyone have any questions or comments in response?
Yeah, I'm Donna Bolin, Bloomington Alderman, so I also am an elected official, and both the city and the town are the funders. So I certainly appreciate your comments regarding, through your expertise as a provider, but I believe that it is the elected representative on these boards, whether it's Susan Schaefer or John McIntyre, myself, or Mr. McCarthy. It is our responsibility to go out and share the information that comes here. That's why we're here. As far as transparency goes, I don't think we should expect all the other providers to be sharing the transparency. I know that Vanessa and Cassie also share the information. I just want to make that clear and to this whole group and also to you. So, thank you.
I would like to speak. Oh, go ahead, Diane.
I just want to echo, we're kind of data nerds at the Baby Fold, and we collect a lot of data. And I know Susan and I, as well as other providers, have talked about how we have struggled on the children and youth side to not have data that we have data within our individual organizations, but that developing that data system similar to what was done on the adult side in the county's work We just aren't at that point with children and youth. So I know the data piece. I really am glad to hear you lift that up, and I do feel it's something that's on our radar about how can we get better data. So many times our funders for children and youth, they want certain data, and we collect then different things in different programs, and we don't have a good way set up for children and youth yet to determine whether these are unduplicated clients in different services at different agencies, or families, clients that are getting multiple services. And it really is kind of what you all were able to tease out on the adult side. And I think if we can get some of that data for children and youth, then how we can invest these resources, knowing that we've got to prioritize, we'll be able to make better decisions. So
I might also add that in the mental health action plan, the attempts at collecting data and metrics may seem very general and broad. And the idea there is that we have to start somewhere. And so this first recommendation or update is the starting space. And so it's not meant to suggest that what is here today is the ultimate goal, but it is the starting point. And so the idea of what we are looking at is yearly updates. And so creating a system-wide template that could begin to collect data, the same data from the agencies and programs that we're looking at, is the beginning step to then understand how do we get those more meaningful or deeper level metrics. And so that's the one thing I would want to speak to as far as some of the language that was used around data collection. Is that we are kind of starting at the bottom, and you have to start somewhere, and this was the first space that we could go in the next 6 months of the year. But I do appreciate that highlight and want you to know that that is something that has been continued conversation, and I think that there are going to be a lot of efforts made to increase and find more well-defined metrics within the programs and services we have in the county.
Next, we have Tricia and then Sonia Reese.
I just want to comment with regard to data collection and some of Diane's points that over the years, as we looked at other jurisdictions and what they were doing with regard to data collection and data sharing with regard to mental health and at times the intersection with the justice system, the biggest challenge for Illinois jurisdictions is the Illinois Mental Health Statute, which is much more restrictive than HIPAA. And so there are a number of states and jurisdictions that have been able to share mental health data and be able to look at whether folks are duplicated or unduplicated across agencies and systems much more easily than what we can in Illinois. And so there are some challenges that are unique to our state that make some of that data sharing a challenge. And so I think, again, kind of as Vanessa said, when we start with easier, simple, more attainable goals, then we can begin to build upon them. And so how do we begin to collect and share the data that we can as we move forward? But I just want to make sure that that piece is highlighted, because knowing that not everyone lives within the HIPAA and Illinois mental health statute world who's sitting at the table today, that is one of the challenges that we've come into several times.
I just want to follow up on Donna's comment about the role of elected officials in conveying this. I think it might be useful for us at a future meeting to have a topic on how are we communicating it right now, and what are better practices. If we say the public wants to know, how do they want to get this information? You know, we get now a report in the Panagraph. I don't know who gets Panagraph all that much anymore. But we get that report about where we are with COVID, because that's been high topic. I don't know how we report how we're doing on mental health and so on. So it's my thought about next meetings. Appreciate your comments, Lizzie, and yours too, Donna. Thank you.
Since we have mentioned the shared sales tax, we have an intergovernmental agreement with the city and the town. And prior to my time in this role, the city and the town were we're very forward-thinking and innovative in understanding the needs of this community and appreciating that we needed extra effort in the realm of mental health. But I will also let you know that the efforts of this group and the mental health action plan, if you look like kind of at a Venn diagram, there is an intersection between Behavioral Health Coordinating Council efforts in the mental health action plan and the funding sources through our shared sales tracts, but they are not synonymous. So there are lots of things that intergovernmental agreement supports that do not touch the efforts of this group. And also this group understands that taxpayer dollars are the funding of last resort through those efforts. And we do look at grants, we do look at fundraising efforts, as Diane pointed out. There are lots of different sources of funding that go into that. So just wanted to make sure everyone was clear on that. Susan?
Yeah, thank you. For one, being the DDJ champion for DDJ, one of the things that I've been working on with other DDJ members, I should say familiar faces, I will probably never change my thought on that concept, is the data-driven part of this. And when I have been very active, I'm part of the Aegis groups to change that, and then our data map in the mental health action plan. And what Vanessa said about starting somewhere, we have to start somewhere. And it's, COVID has actually kind of slowed down some of those efforts that we would have been doing for the last couple of years, moving forward with that and sharing data. And there have been other conversations with when Tricia mentioned the Illinois Mental Health Code, talking with Mr. Block from AOIC, and actually the Illinois Supreme Court has acknowledged that in their task force report. So probably, hopefully, we'll be looking for legislation to change that. And that is one of the things that us electeds can, and actually everybody can do with their groups that they have that lobby for them. The other thing that I would like to actually make another comment on that kind of follows up on Donna's, at the full board meeting last month, I had made a comment that not one board member had contacted me in the last 18 months or so when working on this mental health action plan update. To date, not one board member has contacted me for any information to ask and learn about anything in here. So I just want to make that comment that there are, for electeds to convey this information, I'm not getting any questions from anyone other than Donna. Donna actually has called me and asked me some questions. So thank you.
I've talked to Donna as well. Yes, Lizzie.
I do want to comment on that. Is the mental health action plan was being worked on. I was sitting on the health committee as Ms. Schaefer was working on it. When I found out about it, I did ask you after one of the meetings. You had mentioned that you were working on it, and I offered to help. And I was very clearly, you felt confident, you had it under control, and that was really the end of the conversation. So I did not pursue after that because it did not seem like you were interested in having me participate, and so I did not pursue. I felt like this group is an excellent group and had it in hand, and so I was trying to wait and see where the products were coming from. But I did offer, I think it was last September, October, I think it was after one of the meetings, we had a conversation, and it was not seized upon. That opportunity was not, so.
In the interest of moving on, I want to respect the time of the three that still haven't spoke yet. So let's move on. We have next up is Sally Bulky Pancrazio. I hope I pronounced that properly.
Thank you very much. You talked a lot about data, and you're going to hear more requests for data. My background, I spent 18 years at the State Board of Education, as Chief of Research, examining the condition of Illinois education, and then moved back to the university in the area of teacher education, retired as dean there. So my two comments this morning relate to those experiences, particularly calling for more data here and there, and data that are outcome oriented as opposed to only input and treatment oriented. I appreciate the opportunity to review the action plan, and I appreciate the opportunity to meet all of you this morning. My two focus comments I'll highlight, and I know that you received my copies in your packet, so I just want to highlight how I think it's very important that we have an overall index of mental well-being here in McLean County. And I know that those kinds of assessments are possible. We have 172,000 residents, obviously, with a representative sampling. There are techniques in order to assess the extent to which mental health is, where it is as an index. Do we have 20% of our residents or families suffering mental health, or are we at 80, or where are we? And such, the National Institutes for Mental Health has a plethora of assessments that could guide the development of an assessment system. It not only provides baseline data from which we can then over time see how we're doing relative to the mental health needs of our county, but it also provides information on the incidence of problems and disorders. So I would urge that you consider that as a working agenda. And frankly, I've heard that there are assessments discussions in the works. So more data would be very helpful in that regard in order to have that kind of where are we, where are the various subgroups such as children and youth, families, the homeless, veterans, and those folks who are already in a psychiatric facility. So I would urge that that be a part of your agenda. Second, I'm a lifelong educator. You're going to hear me talk about the importance of the kind of thing that Diane was talking about, those school-based programs that are both remedial and developmental. And I am impressed with the range of work that's already going on in school-based programs. But I ask that you consider overall more emphasis on the outcomes, articulating the outcomes related to those programs. Specifically, I want to talk about three that, if they were coordinated, could provide a continuum of services for all children, kindergarten through high school. Right now, it's sort of a patchwork quilt. And I think there are opportunities through the regional office and others to be able to seam those patches together in a way that provides access to mental health services. Just as a reminder, the 2003 Children's Mental Health Act required the State Board of Education to establish social and emotional learning standards and to have those implemented in each school, public school, and district in the state. Now, they've done this in a variable way. Some have done it more than others. But in any case, the standards are designed, and I quote, to result in outcomes prompting mental wellness, prevention of mental health issues, school connectedness, reduction in school absenteeism, reduction in suspensions, reductions in disciplinary actions, and improved academic success. These are for all kids, regardless of their background, regardless of their needs. And I have a teacher that just got hired at Lexington. She's already working in some of the schools in Olympia in the summer. And to be able to see counselors come in and work on specific ways to teach kids how to manage and regulate their emotions, how to define their emotions, how to use techniques in conflict resolution at that age and throughout the system has been absolutely remarkable. The second is the embedded school program that Diane spoke about at Fairview. The superintendents from those schools or districts have been very positive about the importance of having counselors in the schools. You already know that kids are referred either by their teachers or their parents to those programs. And they, again, are very important. And I'm sure the superintendents, as they talk about the importance of these programs, are using the same kind of criteria. Greater academic performance, more days in school, that is in attendance, because that's where they learn. Fewer suspensions, fewer disciplinary actions, better sense of self-worth, and a better school climate, and there are others. My concern in the mental health plan was that only $100,000 was allocated to this program. Now, these are kids who are experiencing the for new monies, for new monies. I would respectfully remind you that a teacher coming out of our teacher ed program is now being required by the state to be paid $40,000. And I know counselors make more money. So that extra money will only account for maybe a counselor and a half. I urge you to look at that as a preventive and a remedial measure to raise that amount. Obviously, mental health needs at that level with kids starting first grade and then those that are referred to the embedded school program, that's money well spent. And that has a potential for ameliorating problems that are going to cost the city, the county, the state a lot more money in the long run. So I urge you to take another look at that. The third area was 2 days after the mental health plan was approved by the county board, the Panagraph published an article on the proposed Bridge Academy. And as all of you know, that's designed for that next level of kids, those kids who are either transitioning in or out of mental health, out of the hospital because of mental health problems. That, to me, is an exciting initiative. It's an experiment, and because that is an experiment that has not been, it's not a traditional program in dealing with kids who have that kind of severe challenges, it should be treated in a way that the inputs, both the educational inputs and the therapeutic inputs, are very well articulated, and that the outcomes that are expected and desired from that program also be articulated before the program begins. And that way it can be better evaluated and more, also importantly, replicated so that it can be a model for elsewhere. The fourth aspect of mental health in the schools has to do with the teacher requirement. I think Susan spoke to it at the county board meeting. And it had to do with the recommendation that school staff be trained in the mental health first aid to you as a training module. I've been reading more up on it. I'd like to participate in it. I think more information needs to be out there about it for people like us. I would also ask, it sounds like that kind of module is extremely important for pre-service and in-service teachers. I think the outcomes associated with that kind of program need to be examined. I think, Susan, you mentioned that 2,000 teachers have been trained in that, and I think that's pretty remarkable. What have we learned from that? How is it being monitored? How are they taking that, perhaps linking it to the social emotional standards in curriculum and instruction or into the embedded school program? How can those be tied together in a way that's seamless and is a continuum of service for kids who just need to know how to get along with others and make friends, up into kids who need help in terms of their hospitalization in and out of that kind of thing. So the other part is Illinois State University, as you probably know, we account for 1 out of every 5 Illinois teachers. In the state, or in the country, Illinois State ranks up between the top 5 or the top 10 producers. So if you have a module that works in terms of training teachers on red flags or assistance, the potential for making change is extremely important if you have linkages with Illinois State. And I would urge that those linkages be made. If it's worthwhile, it ought to be in the teacher ed program. That concludes my report, Madam Chair. Thank you.
Thank you, Sally. Any questions or comments for, yes, Tricia?
I just want to provide a few responses because a lot of what you addressed pertains to education. And so a few things. The embedded schools and the funding that comes through the Board of Health for that. There are actually mechanisms in place that allow for the contracted agency to bill for a lot of the service. And so it provides more than 1.5 clinicians.
Then the new money is, the request for the new money. I'm sorry if I wasn't clear.
So the funding allows for what is not covered and billable by insurance. There are also schools who are funding their own so that the schools can bill for a number of the services. There is a push, and right now it is pending with CMS at a federal level to be able to change what schools can bill to Medicaid for services provided within the school for clinicians, which would actually really expand the type of recovery and what services can be offered. Part of the transition from Board of Health funding directly to the Center for Human Services to the regional office is so that we can begin to look at the bigger data and across all systems. And so there are identified outcomes and objectives in partnership with CHS and what they are looking at. We just took over as the contract holder in January. And so part of what we will begin to do is actually begin to look at what that data is and also look at are there differences in outcomes when it's contracted with CHS or when the district hires themselves to see does it make a difference in where that person is coming from and directly hired or contracted and what are the other outcomes. With regard to Bridge, we have identified outcomes and objectives and specific goals, and those have been identified in each of our applications for funding. So those are things that we will be reporting on after the school opens, but are part of the plan that were identified to each funding source that we applied to. So.
Thank you. Thank you very much.
Next up, Sonia has requested to speak.
Thank you, Sally, for your comments. I'm just, as a representative for the Board of Health, I'm here to also remind you that you have property tax money that's coming to the Department of Public Health. And in that way, about 1.4 million is being spent directly on services in this area. It doesn't necessarily come before this group, but it goes before that group to fund, and we fund counselors in some public schools across the county. So happy to bring a program in the future. Amy Hancock comes to these meetings, sometimes is even sitting in the back of the room. Oh, there she is. Okay, well, let's get Amy involved in a report to this group next time or sometime.
And I will echo that September's focus, just following up on our systems of care outcome, will be focused on youth and child serving services. And, should it be recommended that Amy have an invitation to sit and discuss the Board of Health, efforts to support some of those, that would be welcomed.
Good, thank you.
Okay, we're going to take one more and then we're going to have to move on. Susan?
I wear many hats. I'm also on the Board of Health. And yesterday, we actually had a policy and funding committee meeting when we were discussing funding for things like the embedded schools. So this has been discussed and will continue to be discussed. On the mental health first aid, that is a collaborative with many others, and I do not know what metrics they track on that.
We can certainly follow up on that, though.
Thank you very much.
Yeah. Thank you for your patience to the BHCC members and also to Mr. Doug Lamb, who is up next, if you'd like to go.
Thank you. I am a clinical psychologist, and I had 35 years, plus or minus, in the psych department at Illinois State, where I also was director of counseling services. I'm aware of the time limits here, so I will just highlight a couple of suggestions from the two suggestions that I made in the written statement about mental health interventions, services and interventions, as well as outcome information. I also want to say that this group is a role model for early meetings. And I'm going to consult you about how to pull that off. Regarding the suggestion related to mental health treatment outcome measures, I will just quickly echo what you said and Sally said about the importance, the encouragement, perhaps the mandating that inputs like a treatment for PTSD or whatever be clearly identified, as well as the outcomes that you've identified with that project before and prior to implementing the interventions. Doing that tightens the treatments, defines them better, and produces more meaningful and measurable outcomes. So I'm just encouraging you to make sure to do that prior to the interventions. The other suggestion that I made in the written statement was about establishing some sort of group or committee within your group to deal with outcome measures, and I've identified the responsibilities of that, the charges, the responsibilities of that group. And then the other recommendation was related to pairing funding with those sources that do fund agencies to reward them for identifying, developing, and implementing outcome measures. The second suggestion I made was related to mental health services and interventions. And my own opinion is that I think it would be in the best interest of your board, your council, to request from county mental health services to identify the percentage of their services that are devoted to the 5 categories of mental health services that I've articulated in my written statement, as well as to have the relevant social agencies also identify the programs that they have listed under each of those 5 categories: crisis, intervention, developmental services, remedial services, and educational services. I think it's my opinion that gathering that sort of information gives this board a much broader view of the available services and thus can lead to better coordination and issues of duplication. Also, as mental health needs change in the county, the board would have a list of those services that could be quickly implemented to address those changing mental health needs. Finally, I realize, we all realize that the mental health action document has been approved, but I don't think that prohibits a working agenda for this group to deal with what I've suggested regarding the mental health services and interventions, as well as the outcome information. Thank you very much.
And thank you very much for your comments and for submitting that to this group. I think when we originally formed this group, or the people who thought of this, who took the time to put this together and form this group, that was really the intention, was to include more collaboration, and that includes the experts in the field that do the work every day. Thank you.
Thank you.
Comments for Mr. Lamb?
Yeah, I understand both you and Ms. Pancrazio are on the board of directors for Center for Human Services?
We are no longer.
We were.
You were,
yes.
okay. But at the time, some of the comments that you made about the outcomes and things like that, there's my hat, my other hat on the Board of Health. None of those outcomes have ever been provided to the Board of Health for the, when they do their funding. And I'm wondering if that can be done, Joan, now that you're the executive director, what Doug is asking for to have that in the Board of Health information with our reporting, because that's one way to get that information through all of these different groups and be more transparent to that when it comes to those outcomes. So I don't know how that would work.
I think that's something we would need to talk about. That wasn't in the application process. And whether or not we're currently gathering that information, or how difficult it would be to gather that information, we would need to discuss that. Not that I'm not open to it. I can't tell you, Susan, off the top of my head whether or not it's something we can do.
Thank you. And I think that that's part of the data collection that we're, looking at in the data map and the matching and stuff like that. So I think that that's something that maybe we can work on. Thank you.
I'd like to move along because I want to honor the commitment of Xavier in coming this morning and make sure that people don't have to leave in the middle of his comments. So, Xavier Jackson, if you'd like to go next. Thank you.
Okay, well, first of all, thanks for the opportunity to appear, and it has been very informative. This is not quite what I expected. I didn't expect the depth or the width of the topics that were going to be discussed and all that sort of thing. Also, I would like some consideration to the fact that I worked a 12-hour shift last night, got off work at 6:15 up in Dwight. So if there's any drooling or babbling, Okay, about me. I'm a RN. Currently, I'm working in a developmental place in Dwight, the Fox Center. Some of you may know it. But previously, I worked in the acute psychosis ward at the Behavioral Hospital of Bel Air in Houston as a charge nurse for 3 years. I have sort of a unique skill set in that I also worked for the city of Peoria as a 911 operator and police dispatcher for almost 3 years, years ago. All those notes that I took that I brought in here to talk about, I'm going to pretty much probably chuck a lot of those. In the interest of some of the things that I heard folks talking about and reaching out to the community and being more transparent and sort of being able to separate people into the different lanes, for lack of a term, that they go in, okay? The virus that changed everything on March 2020 took everyone's routine, everyone's schedule, and everyone's lives and simultaneously tossed them in the air, all right? People don't do well with that kind of change. And I think that the results can be demonstrated in like the numbers that Elizabeth was talking about, the number of patients that she sees. But bigger than that, having worked in psych for a long period of time, most of the people who are in some type of emotional crisis are totally unaware of the fact that they're in emotional crisis, all right? They just walk around just spraying their crazy all over everybody they come in contact with, okay? I think since March 2020, there's been a lot more of that. I see it in my workplace, especially in my profession. There's a lot of people who are either in the midst of some type of crisis that melt down randomly, and everybody who's within 10 years of retirement age is walking away from the game. It's leaving a lot of inexperienced people, and those of us who then should pick up the mantle and try to be the mentors and the trainers and that kind of thing, I'm too concerned with my own emotional well-being to invest that energy. And I'm ashamed of that, okay? But that's kind of been sort of the vibe that I've seen throughout, not just this community, but other communities, that people are sort of checked out. Everybody is like every man for himself sort of variety, thing going on. It might be beneficial to have some type of large promotional campaign to just get people to come out and say what they need instead of trying to speculate as to what they need. Some type of big outreach, promotion that doesn't sound like mental health, okay? Because people are going to not want to be stigmatized by that. And doesn't sound like government, because nobody trusts the government. I don't know exactly what that would look like, okay? But if we could somehow touch that part of people that's still honest about the fact that, yes, I am struggling. Yes, I need help. I cannot afford $100 tanks of gas, okay? Then that would be a good way to get more input and to be more specific and to be able to focus some of the things that you're talking about. Now, you're saying about transparency as far as outcomes and things like that. I don't know that people are willing to admit their deficiencies because they're afraid that somehow or another it's going to come back to them as a weakness and they're going to be punished for it in some way, all right? Or stigmatized or labeled. And this is a time period where I'm telling you, and you guys probably know this, but working people are on a tightrope right now. People are just barely holding it together. And any other little thing that comes along that shakes that tightrope, people are falling off the tightrope. You see them melting down at Target. You see people yelling and smacking their kids, and folks turn their head and walk away because they don't want to get involved. All right. Some type of message to the community from all these services, and man, to this board and the resources you guys have accumulated, and all the different professionals and the skills and qualifications I hear in this room, outstanding. Okay, but these people that are out here in the street don't know that you're there, and they don't know that you care. They don't feel like anybody gives a damn, frankly. If I understand that way. One of the things I did want to talk about is House Bill 5319. I know people know about that. It was passed. I was interested in what this gentleman was saying down here. It was passed and signed not that long ago by the governor. It offered 4 test cities for a program similar to what you were describing that puts people in the field with the police on these calls. Reading through the bill, some of the stuff I didn't like was some of the things you were talking about. These people are supposed to be under the purview of the police. Having been a police dispatcher, I can tell you that, when they get to the scene of the call, if somebody's behaving inappropriately, that person is a suspect or a criminal. And trying to split that line between suspect and patient or criminal and victim, the police don't really have the time for that because you've got 12 other calls holding your district. All right, so if I get there and you're cutting up, you're going in the paddy wagon. I also don't know about some of the things you were saying about people going on these types of calls without the police, all right, because things happen fast and things turn violent suddenly. And, the safety of those who are responding probably has to be something. So anyway, since Bloomington Normal has all these different sort of levers in place, the other 4 cities are Peoria, East St. Louis, Waukegan, and Springfield. No offense to East St. Louis and Peoria. I'm from Peoria. They're not as organized as you folks. They don't have as many resources as you folks, and they were given 6 months to put this in the field. Now, in spite of that, I think that they will still probably have some type of success because this is what is needed. And I know the police will appreciate it because as a dispatcher in Peoria, I get a call, the husband and wife go to jail, and now my officer in 4 District has to sit there and wait for DCFS to show up for an hour and a half while these calls back up. And have to get other calls from other districts to cars to hump his calls, and they hate that too, So I think that it's going to have success, all right? Eventually, they're going to either approve more cities or it's going to become a statewide deal, this House Bill 5319. And, in order to sort of like some of these things you're talking about in your action plan, et cetera, to coordinate these things, all right, that might be the means by which you can do it. Because the 911 people, the calls that come through the 911 aren't always emergency calls. But to be able to have people who are trained to understand those calls, and understand the radio language, and it's a whole nother language on the radio, and to be able to know that they need to respond, and to be able to delegate to some of these folks in some of these different agencies could help, A, gather the information in the metrics you're talking about, and B, sort of shuffle these calls to the places where they need to go, with less hubbub. But there needs to be a huge outreach to try to take the distrust away from the public about government agencies and about interacting with the police, and the feeling that everybody's on their own, it's every man for himself. It's a very road warrior out there right now, and it makes me afraid for my children. All right, it makes me wonder if we're like presiding over the death of empathy right now. And and I don't know exactly what it looks like, okay? But it seems like there's enough resources and there's enough empathy among the people I see in this room. I can see that you want to help people, all right? But I don't think they know it, all right? At some point or another, it has to become less of a theoretical thing and boots on the ground in the field. Here we are. What do you need from us? Instead of saying, well, this is what they're going to need. Somehow or another, we need to get out to these people and let them know that we're here to help them. Well, I'm not among you, but you know what I'm saying. And what do you need from us? I mean, I think that a lot of the old models are not going to necessarily work, and lots of the old ways of thinking. You know, we have new devils like social media to deal with. When I was 18, 19, stupidity could not proliferate as fast as it does now. There was one phone stuck to the wall, and all 6 of us had to share it for 15 minutes at a time, all right? So dumb ideas and, you know, teenage hostilities, adolescence recklessness could not spread as fast as it does now. Some type of focus on, you know, a more modern approach. You know, never mind what the traditional roadmap is. All right, what do you need from us? You know, how can we help lessen your burden? Because people are getting crushed right now by life. All right, and again, like I said, I see it in my coworkers. My patients are, you know, all developmentally, they have problems, so they don't complain. But before, you know, I worked at Methodist I'm an agency nurse, so I work on contracts, okay? I work on contracts, 13-week contracts. And I worked at the behavioral on 8 Hamilton, I think it is, in Methodist for 8 weeks a couple years ago. And then I did like six months in a COVID-infested death trap over there that made me sort of retreat to the Fox Center because watching people fight to live and lose, I don't know. Anyway, so it's a new game, you know? It's a new game. COVID-19 changed everything. I don't think that there's enough of an acknowledgement of that, you know? And COVID-19 is going to continue to change everything. You know, I have to swab all of my coworkers and a lot of the individuals that I work with, and the next coworker that comes in going, you know, I saw something on the news, blah, 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 and they do this, and why did they do that? I'm going to throw them out the window. All right. Okay, sorry. Okay. But anyways, sorry.
We're at time, and we thank you, Xavier. We have your contact information as well, and it's been shared with a group, I believe, from
The
your
dispatcher
letter.
component of this is a big thing.
Yes, it is.
Okay. These folks talk to a lot of people on the phone, you know, and some of them don't even turn into calls. But if they could funnel that to somebody who might be able to help them from an emotional standpoint instead of a crime has been committed standpoint, that would be a big way to get the contacts that you need to get too.
Yeah,
So.
I think 988 is addressing some of that. Zach?
I can actually provide a little more information on the bill he mentioned, and I can do it in like less than 2 minutes. So that bill was passed by Jihan Gordon Booth.
Yep.
The CESA Coalition actually worked with her on that bill. To be clear, that bill is not a first responder bill, it's a follow-up responder bill. And it's only for survivors or witnesses of crimes that may have mental or behavioral health. And thanks to the CESA Coalition, we actually got it moved away from a co-responder to more of an alt-responder model. So yes, that's in place, but it's not a first responder model like CESA is, it's a follow-up response. And while I completely recognize that a lot of people worry about the safety of people going to crises, I would just remind you of the stats that we have from Cahoots. Less than like 1% of the 20,000 calls actually required police assistance. And this is still them going on their own and then requesting it, not them going with police. So there's a lot of fear, but the data does show that when it's not police, when it's just the alt responders, that there's very different outcomes. I hope that was helpful. I'd be happy to talk to you more as well.
We're going to move
Or anybody
along. We still have quite a bit on our agenda, and we're going to ask Vanessa to speak very quickly. But next up, we have a special topic on staff recruitment. Vanessa's going to introduce that. Sure.
Before we move on to the special topic, I just wanted to, again, thank you all for taking the time to come and share your recommendations, your concerns, and your considerations of where we can go with this mental health action plan. I would like to notify and let you all know that every year we will be looking at the recommendation sections of the Mental Health Action Plan and moving those forward. And so we would encourage for you to come back in December and hear how what you've shared today might be influencing what we're doing in the next year. Also, I'd also like to let you know that now I know your names and I have your contact information. And so you will probably be hearing from me more, and I would welcome your expertise in the areas that would help support and move forward initiatives that we've identified. So thank you. So we are moving on to item F. It's a special topic proposed by Member Hartman. She would like to open up discussion focused on staff recruitment, the possibility of a survey of salaries, and how we might focus on recruiting talent in the mental health realm to our community, what partnerships that we can do as agencies here at the table to support that for McLean County. So can you turn it over to Joan?
Thank you. And I'm sad to see everybody that we've lost several people. I want to thank you for your comments, which leads to this whole topic now is that I completely agree. I see it too. It's heartbreaking to see our community members really needing services and needing help, and us being unable to meet those needs because we can't find the staff to meet those needs. And I do wonder about the death of empathy myself. I think that you've brought forward some very poignant comments, and I thank you for coming. I thank everyone for coming and sharing your thoughts and recommendations. I'd like to follow up with you about some things, just making us better. I think any questions that we have about how we're doing things just make us better when we pay attention and try to address those questions. So I thank you for that. The reason why I brought this topic forward is because when I talk to other executive directors and CEOs, we're all in the same boat. We're all fighting for the same people, the same limited resources we have in terms of human capital. Chris Workman actually started me thinking along the lines of when they were recruiting for the 988 line, the amount of people or applicants that they tried to get from out of our area to come into the area. And so I wanted to propose that we put together a subcommittee of this group to start looking at how can we work together to recruit people to our community to fill the positions that we have. Because otherwise all we're doing is shuffling our deck. And we're working to see if we're paying more than Chestnut or we're paying more than Broman to see if we can entice their people over into our shops. And that makes it doesn't make any sense to me at all that we're just shuffling our people. Not that our people shouldn't have choice, but we should not be just having people go from place to place based on salaries. And so I just wanted to I don't think we need a lot of time. We need a lot of time in a subcommittee to actually work on this and potentially pull in other community resources, the Economic Development Council, potentially other resources to assist us in this area.
I think that's a great idea. It actually kind of falls in line with some of the goals in the action plan on access to care. And I think that that will help because that way we know, and it's just like the salary study that we're doing for the county to make sure we attract county employees. I think that that's a great idea because it is a big challenge everywhere. So I think it's a good idea. I have no say in the matter because I'm not a provider, so.
Yes, Teresa.
Okay, sorry. And I know I'm new, but I appreciate you saying that, Joan, and I also agree 100%. When I listened to the people that spoke here, and especially the last gentleman, you can hear it in his voice. And I mean, I'm a nurse also. You don't have to be a nurse to hear that, but it's not, when I I'm so happy to be here today, first of all, and to be able to hear about a lot of the things. But it's not just the mental health of our community, it's our providers and our people that are providing the care too. And when I heard him speak, that's what we see all the time. Elizabeth talked about, how many patients she sees and the distress that she feels because she is not being able to meet their needs. And we're all doing the same thing. So I think it's kind of twofold. I liked the fact that they were talking about Illinois State and the teachers and the peer recovery program, but we've got to figure out a way to draw more providers, both physicians, nurses, therapists, any level, and not just keep pilfering from each other, because that is what happens. And we have extraordinary people in our community that are providing these services, but we have to figure out what's the draw. And when we're being recognized nationally and there are these things going on, there's some of your selling points, so it's how do we get that word out, or how do we grow people from within, because there's not enough of anybody to do it. All the great ideas there are, if we can't staff them or we can't, it's just, I don't know. I don't even know how to put it into words, but I'm in, or we're in. Yeah.
Again, a really great recommendation, and I think, coming together as a collaboration of providers and mental health for McLean County, like how awesome that would look to go to a career fair or to sell it at a university. These are all the spaces, these are all the people that work together, and this is how we do it. And so just in the purpose of that, I will follow up to work on establishing a work group that is focused on staff recruitment and retention. And so you will be receiving emails. We will also identify additional partners that may not be at the table that we think would be important members of that conversation, and get a really good group together.
Vanessa, moving on, let's go to G, program initiatives, initiative updates, excuse me.
And in the respective time, well, I first want to say thank you everyone who's still here at the table. I know today is going pretty far. You have all received the packet. I'm just going to highlight some things that I really want to promote about our programs and some new initiatives that we have moving forward, and then leave the rest of the space for any questions that you could follow up with me here today or via email. So regarding FUSE, again, the overall statistics of FUSE continues to indicate reduction in shelter utilization, ED utilization, and decreased justice contacts. One of the new things that I wanted to point out in this section is how we are identifying and differentiating our potential participants. We are now looking at active and outreach potentials and getting a better idea of where they stand in the process of getting into our program and what those numbers really look like. And so looking and being able to better differentiate that is going to help us look at what is the barriers of getting into FUSE. And so you may have heard that as a criticism, that maybe the criteria that we have of getting into the program is too restrictive, which has downsized our numbers. And so we're going to pay more attention to that, evaluate that more clearly, and get a better sense of what we might modify and or expand within FUSE, so that we are able to reach a wider brand of individuals that fall within our frequent or familiar faces category. And so that was just one new thing I wanted to point out about FUSE. The one thing that I want to point out about the McLean County Triage Center is April marked the highest number of contacts that they have seen since opening date. And the numbers have continued to increase over the last 3 months. So I do want to send my appreciations to Kevin McCall. He is here out in the audience with us. He is the supervisor of the Triage Center. To him and his staff, they have been very involved in outreach to different agencies, different providers, different businesses. And we have been really intentional about looking at ways to more directly collaborate with the law and justice side of McLean County government. And through all of those efforts, I think we're starting to see an uptick in the utilization of the center. And we hope that that continues over the next couple of months. Credentialing, we are still at Molina as our one provider. We are on the preface of being credentialed with Blue Cross Blue Shield and very close with Meridian as well. So I just mentioned this to say that Fuse and Triage are very near the process of being able to bill for the services that they're already providing, which will help, again, the expansion of the program, our ability to offer these services to a wider range of individuals, and the ability for behavioral health coordination to expand its services as well. The forum. So this is my one pitch today, and I hope that everyone has taken one of these packets. We have our resource fair ad and sponsorship information packet. So this year's forum will be held in person at the Bloomington Normal Marriott Hotel and Conference Center on Tuesday, October 4th, 2022. Planning has already began. Many of the agencies at this table are represented at our planning committee, and so I appreciate all of those efforts and those times of either the individuals sitting here or the staff that you have allotted to come to that planning meeting. Right now, we are beginning to focus on the resource fair, so getting agencies to sign up for that, and sponsorship. So I would appreciate if everyone would take a packet here today. If your organization and or your connections to other organizations, businesses, or agencies here in the community, if there's anyone who would want to help support these efforts, we would appreciate being able to offset some of our costs and, again, being able to expand what we're able to do at the forum. Next, we'd like to call up Taylor Davis for a quick update on Ryze's latest initiative programs.
Oh, okay. All right. So Ryze McLean County is still having a lot of momentum and making a lot of progress this year, mostly just because we've had regular meetings. All the participants are attending meetings, sharing really good ideas. We're going to push out internally, at least this year, by the end of the month, our first PowerPoint training on ACEs, trauma, and resilience. And then we're going to have a trauma and resilience infographic done by the end of this month. So super exciting. We also were able to be highlighted in the Peace for Tarpon in Florida, our initiative. I was able to speak at their forum meeting and just share all the good things that McLean County is doing. And then also the Prevent Child Abuse Illinois conference yesterday, I was able to speak at the ACEs and Resilience conference. So our name's getting out there in a lot of communities. There were questions on like, how did you get the buy-in? Why are you making so much progress in this realm? So getting the name out there, and we're one of the, there's not that many counties that have an initiative that focuses on this, so we should be proud of that. But just a little bit of update on us.
Thank you, Taylor.
I know we're short on time,
yes.
but I just want to give a quick shout out to Taylor and the work that she's doing with getting that group rev back up and going, and just thank her for leading the charge.
Yes, yeah, and I would echo those sentiments. I think Taylor has, she's really passionate about this topic, and I think she brings the right combination of passion, talent, organization, and forward thinking, and I think you're going to be really impressed by what Ryze McLean County looks like in a couple of years. Next, we'll go on to a very quick update about the Tri-West crisis evaluation. I know that almost everyone here at this table was interviewed at one point as a key informant. There is a detailed list of everyone that they spoke to in the packet that you received today, so you can kind of get a better idea of where their information is going to be coming from. Right now, they are in data collection, so if you are one of the agencies that are still processing, and I'm one of them, so I'm on the list as well, if we could really work on getting them the information that they need so that they can move forward their report, we are hoping that they are going to come back to us with something in early to maybe late fall. And then last but not least, I've already mentioned that our SOC grant was submitted on Monday, April 18th, 2022. The reward date is August 1st with an expected start date of September 30th. And at the September meeting, we will have a detailed conversation focused on the SOC grant, if we have been rewarded it, and if not, what are our next plans at attempting it a second time, as well as a special topic on youth and child services here in McLean County, beginning to focus on some of the items that Diane and some of our speakers highlighted here today, maybe bringing together a separate work group and moving forward some of the initiatives or ideas that are proposed. But just kind of putting that out there, that September's meeting will be focused on youth and adolescent services. And then last but not least, I'm not going to read to you guys. You see the newsletter every meeting. It's also posted online. It highlights some of our upcoming events here in our community for Juneteenth, for Pride. There's also some resources at the very back of the packet on some upcoming trainings in the area or virtual options. So again, any questions or comments that you might have on any of the information provided, I would welcome that at this time.
This meeting's already gone 2 hours, so are there any last comments that anyone would like to make? Seeing none, I have one comment, and it is with a heavy heart that I do need to inform the group that this is Vanessa's last meeting. Vanessa and her family have an opportunity in another state, so she has tendered her resignation, and I tried not to accept it. She told me I needed to. She was moving to Alabama anyway. And so I believe July 15th will be her last day with the county. And so we will be working on our transition. And so we have some plans in place. I have some conversations with some individuals lined up. But in case anyone wanted to say their farewell, if you don't see her every day, she was probably trying to sneak out of here without getting that announced. But I do want to bring that to everyone's attention. And thank you for all the work that you've done, the time that you've been here. It has been a pleasure. You will be missed. And with that, we are adjourned.